Found all these little things, and then I realized.
All right. Good afternoon, everyone.
Haven't found yet.
Good afternoon.
Good afternoon. Welcome to the Education Town Hall. We are going to proceed by muting everyone who is not a speaker. We got 350 RSVPs to this event, so we want to make sure it runs smoothly. We got 200 questions, so we have grouped those into categories, and that is we're going to be answering them. But we're going to start with people introducing themselves and just saying a few words. I am Representative Rachel Hunt. I represent District 103 in Mecklenburg County. I'm going to need, if everyone can mute yourself so we can all hear, that would be great. I represent District 103, which includes Matthews and part of Charlotte and part of Mint Hill. So welcome. I am here today joined by Representatives Brandon Lofton and Representative, we're still getting noise, folks. Sorry. This many people, we really need everybody to mute. Representatives Brandon Lofton and Leslie Harris, as well as CMS Chairwoman Elise Dashu and Meg Sullivan from the Mecklenburg County Public Health Department, and CMS teacher and great person, Justin Parmenter. So I just want to say that education is the most important issue to me personally and to me as a legislator. You all know that several of us have worked tirelessly in the legislature to try to make changes in our educational system, to get more funding, to try to have things like funding for the Leandro decision. We've written bills on that.
The other thing is when you speak and you're not using headphones.
Okay.
It sounds terrible.
I'm going to say this one more time. Can everyone mute yourself, please? Okay. This is a lot of technology. All right, so So several of us are extremely interested in education, just like you are. My children through CMS schools. Representative Lofton's children are there now. And Justin is a parent and a teacher in CMS. Just hold on a second. Let's see if we can figure out. Bear with me. All right. Are we good? All right. Okay. We're going to start over. I'm Representative Rachel Hunt. I want to say welcome. This is the Education Town Hall. I am joined by Representatives Harris and Lofton, also from Charlotte. Also, teacher Justin Parmenter in CMS schools, the CMS chair of our board, Elise Dashu, and from the Public Health Department, we have Meg Sullivan. So we are here to talk about reopening school here in CMS. Several of us have education as our top priority in the legislature, including me. We have written many bills dealing with that to try to make more money for public education. And we know that many of those bills have not made it to the floor to be voted on, but we control most of the money that goes to public schools in the North Carolina legislature. So you all need to be aware of that. So we are going to talk today about reopening schools. So I am going to pass it over since we had a few technical issues. And I am going to let Representative Brandon Lofton say hello next.
Thank you, Representative Hunt, and thank you for pulling this together. I also, of course, want to thank everyone for being a part of this event. My name is Brandon Lofton. I represent District 104, but more importantly, especially for the purposes of this conversation, I'm the parent of 2 CMS students. And, I can probably, like many of you who have kids in school right now, I can share with you my struggles and attempts to be an amateur teacher this past school year. And so I want to thank Elise Dashu and Justin Parmenter for all their work that they do on behalf of our students, and especially the work they are doing to try to help our students to learn safely. I want to acknowledge something that Representative Hunt pointed out just a couple of minutes ago, which is that the work of our district is actually made more difficult by our state's failure to fully fund our schools. And that's taken place over this past decade. And we saw in the Leandro report, we had 250 pages of evidence of how the state has not done its job to make sure that our districts have what they need to support their students. And so each of us, Representative Hunt, Representative Harris, and I, we've all advocated for and pushed for greater resources for our districts so that they can better serve our students. And this is particularly important in this changing crisis. And so one of the things that we need to make sure that we do at the state level is that we adequately fund our schools. And also, in addition to that, because we don't know what the budget impact of COVID-19 is going to be, we need to make sure that we give our school districts budget flexibility. And I filed a bill to that effect to help give greater budget flexibility to our school districts. These are things that I know we need to address at the state level so that our districts are in a better position to respond to changing conditions with this pandemic on the ground. And again, I just want to thank all of you for being here and thank in particular everyone at CMS for the work they're doing on behalf of my kids and all of our kids. Thank you.
All right. Hi, everybody. My name is Wesley Harris. I represent District 105, which is in the very southern portion of Mecklenburg County, the Providence Country Club, Ballantyne, Pineville area. And I want to thank all of you for joining us today. This is a great turnout. And particularly my colleagues, Representative Hunt, Representative Lofton. We've worked a lot this year trying, as Representative Hunt and Lofton said, trying to boost as much as we can of CMS and our public schools in general in this state. And I also want to give a big thank you for Chairwoman Elise Dashu for joining us, for Justin Parmenter, and for Dr. Sullivan for joining us. teaching is a tough job in any condition, and it is even more challenging in this. And same thing for school board. Serving on school board is probably the most difficult public service you can do, and that's under the best of times. So we certainly are not under that right now. And to kind of go along with what Representative Lofton was saying, on the state level, as we're working to get through this, on our side, a lot of it is dealing with the funding of our schools and trying to figure out exactly what to do. So in the first CARES package that Congress passed at the onset of this pandemic back in March and April, we were able to allocate a lot of money to help our schools kind of get through the end of the year. Now that we're starting over again, that funding issue is going to come back up again. So while we're working in the legislature and we have a little bit of that CARES left over that we are working to allocate, the real hope is that Congress is going to act, because we are going to need congressional help once again for us to really be able to get through this and make sure that our kids and our teachers get the resources that they need to be able to handle the changing landscape of public education in our state. Because again, we have been struggling to fund education at the level it needs to be, and that was before this pandemic hit. That was before our tax revenues took a hit because of the economic contraction, and it's going to be increased by order of magnitude next year as we're working through the budget situation, making sure that we don't leave any kids behind. I personally have no kids in Charlotte-Mecklenburg schools, but my mom was a lifelong public school teacher. My middle sister teaches in Forsyth County, and I have 6 nieces and nephews that are ranging in age from one's about to start middle school this year, was about to start 2 weeks ago, and one's literally about to start kindergarten. And so I understand the difficulty of having a kid that's maybe about to start a new school, a new grade, or start school for the first place in general, and wanting to get them in the classroom and wanting to get them the best education possible. And I think the thing that we need to understand here is the reality that there are no perfect solutions to what we're going through right now. We're dealing with the best medical advice that we can, the best scientific advice that we can, and we're dealing with parents, and we're dealing with students, and we're dealing with teachers to understand we all want to get our kids into school, and we all want to have that in-person instruction, but being able to do so safely without endangering the lives of our children or our teachers or our staff is what's hard. And we're trying to make the best that we possibly can with this. So thank you all for joining. Thank you for asking really great questions, and we're going to do our best to answer them all as we get started today. So thank you again for joining us.
All right, let's have Dr. Sullivan introduce herself next.
Yeah, good afternoon, everyone. My name is Meg Sullivan. I am the medical director of the Mecklenburg County Public Health Department. In that role, I provide clinical oversight and leadership for everything that the health department does. And I can honestly say for the past 4 months, I have been living and breathing COVID 24/7, and I'm really excited to be on this panel. I will also say that I am a parent of 5 children, including 3 who are enrolled in CMS. I am also a pediatrician, and I'm also a former teacher. And so I'm really honored and privileged to be part of this panel and really look forward to having this discussion and answering these questions.
You want to go next?
Sorry, did you say, were you calling for Mr. Parmenter or for me?
I think Rachel froze a little bit, but you can go ahead, Elise.
Okay, and you can hear me? I'm unmuted, right? I'm not used to WebEx. I'm used to Zoom. Okay. Well, hi, everybody. I'm Elise Dashu. I have the distinct privilege and honor of serving as the chair of the school board this year. I was kind of laughing this morning, thinking I wish that I could say I majored in global, school board leadership in a global pandemic, but I actually missed that class. So I'm learning this as we go along, as are, I think, everybody. We're all figuring out how to do this as we go along. I appreciate, I've read through all of the questions. I think there were 128 questions, but a lot of them were like 10-part questions. So we'll do, and most of them appear to be directed at me rather than, than the other panelists. And so have done my best to be able to answer all of them, but trying to organize them into categories because some of them were very similar or overlapping. There will be more opportunities. If we don't get your questions answered, there will be a lot more opportunity for sharing information tonight. There will be, we have a long school board meeting tonight, and there will be an updated presentation on reopening plans from our staff, who are the real experts. And so please tune into that. We also have a lot of public speakers tonight. So we have, I believe it's 40 people have signed up to speak. I'm really glad about that, although it will make for a long evening, but that's democracy. That is the beauty of democracy, and we will be listening with all ears to what the public has to say. A lot of teachers are signing up tonight. There will also be a Facebook Live at 7 p.m. on Thursday evening, a Q&A, a Facebook Live for specifically on the Remote Learning Academy, the full Remote Academy, and comparing that to regular school. And so, we'll have experts on Facebook ready to field your questions there. And that's Thursday night. I think that's going to be a huge opportunity to get some questions answered. And I will just echo what some of the legislators said in their introductions. Part of the challenge for our schools in responding to this pandemic is that we are dealing with systemic underfunding that has built up over the years, especially as regards to our facilities. And so we just have to be real about that. And so as we watch the emerging science and as we watch the pandemic, the COVID numbers specifically in Mecklenburg County, we feel like in order to be having kids in the schoolhouse on an ongoing basis, we need a little bit more time to bring those numbers down and to have all of our plans solidly in place, because I'm not going to be able to sleep well at night if I feel like, well, we don't have that quite figured out, but hopefully it'll be okay. So I guess that will be my introduction, and then I know you've got more people to introduce, and I'm ready to dive into the questions.
Yeah, one follow-up, Elise. Can you tell people how to log into the school board meeting and the Facebook Live?
Yeah, so maybe while Justin is speaking, I can post a link into the chat message. How about that? But basically, if you are able to go to Facebook, just go to the Charlotte-Mecklenburg Schools Facebook page. There is an event on there for both the school board meeting, and there's an event for the Facebook Live, and you should be able to join that way. Also, there's a Charlotte-Mecklenburg Board of Education Facebook page. Both of those things should be there as well.
Great. Thank you so much, Elise. And now, Justin Parmenter, you can introduce yourself.
All right, thank you. Well, hello, everybody. I appreciate all the members of the public that are here to participate and to listen today. And it's an honor to be involved with such an esteemed panel. And I really appreciate the fact that that you all value hearing from educators and hearing that perspective of the people who are working in our schools and who are tasked now with trying to figure out how to implement, policies that are going to educate our children as best as we can and keep them safe at the same time. I'm a 7th grade teacher at Waddell Language Academy, English teacher. I just finished my 25th year in the classroom. It was by far the strangest out of all my 25 years in the classroom. I love what I do being a teacher. It feels like something that, that I was born to do. And this pandemic really came out of nowhere. The last day of school I remember was Friday the 13th. We were making kind of the standard jokes about that. I was reviewing for a poetry test with my class that they were going to have the following Monday. We had students clean out their lockers because there was a little bit of chatter that things might be getting a lot worse, and we just wanted to be prepared. But I had no idea that I wouldn't be seeing them again in person that school year. And it's been hard. I know it's been hard for all the parents and families that are on the call. It's been hard for all of us. For educators, I think there was a really huge learning curve because of the unexpected nature of having to adapt everything that we rely on in-person interactions with to a virtual platform. So I know you all, many of you are aware of how big that learning curve was and struggled right along with us. And, you know, I'm a parent of two CMS kids as well. I have a rising 5th grader and a rising 3rd grader, and I watch them struggle. They're in language immersion, and I don't speak any German. And so to watch them, you know, trying to get the best that they could out of those lessons, it was really difficult. And there's no question that there's a big drop off, and that what we need to do is to get back to normal and to get back to, you know, that face-to-face in-person instruction. There's just no substitute for it. A lot of our kids have needs that are not being met right now while we're in remote mode. They have social needs. They have more complex needs that when school closed are a lot more difficult for us to meet. And we know there's been a tremendous impact on working families as well, who can't afford childcare, who may be forced with making a hard choice between quitting their jobs and not being able to provide for their families. But, you know, as an educator and thinking about the landscape and this huge problem that we're facing, you know, I have to keep in mind that we're in the middle of a full-blown global health crisis that is killing people. And yesterday we passed 100,000 cases in North Carolina, Mecklenburg. I'm sure Dr. Sullivan would have a lot more information on this than I do, but, you know, it's still one of the most dangerous places in the state in terms of infection rates, as far as I know. And the more and more we learn as new research comes out about this virus, the more that I get worried about the risk to our students and staff. Early on, there were just a handful of studies showing that, you know, that children maybe were not as likely to transmit COVID in schools, but they were just a very small number of studies that were based on research that was happening right while schools were closing. And now that more time has passed, you all may have seen there was a study in the New York Times a couple days ago out of South Korea that was praised in terms of its scope and its rigor. And it found that children up to age 9 are roughly half as likely as adults to transmit the virus. But children from ages 10 to 19 are as likely, if not more likely, than adults to transmit it. So those are the very real dangers that we're facing. And I think they're risks that we have to take very seriously. We all want to get back to normal, as I said, but, you know, we can't, that's not something that we can wish into being. And I think that as educators and as policymakers, we're going to have to get there through being really cautious in our policies and through, as community members, adhering strictly to distancing protocols and that type of thing. And we were not going to be able to rush into that normalcy. It's going to be rocky. I know CMS has had the summer to work on developing virtual instructional materials. I don't have a lot of detail on that yet, but I believe that we're going to see a lot more consistency and a higher quality virtual learning experience across the district, which hopefully will help with some of the parent frustrations that we experienced last spring. So we'll do the best we can. We need to, hopefully we can remember that we're all in this together, trust the experts, and be kind to each other. Thank you.
Thank you, Justin. All right, I would like for Chairwoman Dashu to now start on the questions. Thank you all for sending in. We got, as I said, over 200 questions. I think she has divided them into categories. So Chairwoman Dashu, you are up.
You're still muted, Elise.
Ooh, okay. Can someone unmute me? Am I unmuted?
Hey, you're good now.
Okay,
You're
good.
good.
Okay, thank you. Okay, so we'll start with, there were a lot of questions about metrics. And we do need to have some sort of an objective way of knowing now it is safe to reopen. I know that a lot of districts around the state have gone to remote learning for a full quarter. I would love it if we don't have to do a full quarter. I'd love it if we could see in a few weeks the numbers come down enough to be safe to open, but we do need some metrics to guide that. So we have, our superintendent has convened a internal medical advisory team, and they are working with health department leaders as well as private providers to propose benchmarks to gauge when it is safe to reopen schools for students and staff, safe for staff and safe for students. We're also comparing notes with the 12 largest districts in the state. The superintendent takes part in regular, conference calls with the superintendents. That many of them are going through this exact same process. So we are kind of pooling the brain power on that. So those are metrics. There were some questions about what are other districts doing around the country. I mean, around North Carolina. I know that when we voted to go to remote learning, that was, we had the highest COVID rates in the state. And also we were, I think, the first district to go that way. Well, since then, since our meeting Wednesday night, about 23 districts have also decided to go full remote. I believe, I was checking Twitter just before this started, I believe Wake County has now decided to do that as well. So that makes about 40% of the students in the district. So that gives a little bit of context of what we really are kind of all in this together. Of course, the hot question of the moment is, what is the difference between the full remote academy and sticking with what we're calling Plan B plus remote? And that is, I've got all kinds of, I can answer in quite a bit of detail about that. You will have until midnight of Sunday night to commit to the full remote academy if you want to do that. The experience of, while we're in Plan B plus remote, the experience that your child will have will be similar between the two. The difference is that when we're ready to bring kids back into the schoolhouse, if you do Plan B plus remote, you will come back into the schoolhouse. If you're concerned about that, if you want to keep your children out for the duration, then you should sign up for the full remote academy. That is a commitment for the semester, but you will have, if you do the full remote academy, you will still be assigned to your school. You're not leaving your school. So for example, if you are in a highly sought after magnet, you will not be giving up your magnet seat. If you are, you will have a teacher from your school, you'll be interacting with your principal. As we figure out how to do extracurriculars in this brave new world, your child will be eligible for that. They'll be interacting with their school psychologist and your counselor, your social workers. If we go back to sports, then you'll be eligible to play sports. There are some families, I've heard from some high school families who are not comfortable sending their kids back to school, but they want their kids to be able to, say, perhaps run cross country. You'll still be able to do that if you're in the full remote academy. AP and IB, all of those, the advanced classes will still be available. And in fact, with the full remote academy, we may be able to be even more flexible so that, say, you've got a few kids, I'm just going to pick Japanese, that's sort of an obscure subject. Say you've got a few kids at West Meck who want to take Japanese, and a few kids at North Meck, and a few kids at Myers Park. Not quite enough to have a full Japanese teacher for each school. We'll be able to pool them together and give them that option. So there will be, as far as scheduling courses, there will be some more, that may actually open up some more opportunities for students. Let me see what else was asked about that. Let me go on, and then I will come back because there's a lot of more questions that kind of overlap with that. There were some questions as to why we're doing this in person. First, let me just apologize. I'm seeing a lot of questions flashing on the chat message. It's just difficult for me to read those and get through all the lists. So please don't think I'm ignoring you. I'm just trying to, I'm not so good at multitasking. So 2-week orientation, there were a few questions about why are we, bringing kids into the schoolhouse for 2 weeks if we don't think it's safe. And so with that, I will say, I am confident that we can practice social distancing and use our masks and keep and keep our students safe for those 2 weeks. They will be divided into small cohorts. And so it would be a third of the kids would come in for just a few days, and then the next third would come in for a few days, and then the last third would come in for the few days. So your child will not be there for a full 2 weeks. I do see a chat saying that there's a sense that we get more funding because of that. That is not the case. And I can talk about that later as well. Districts are supposed to take a head count on the 20th day of school, and your funding is based, the number of teachers that you're allotted is based on your head count on the 20th day of school. So this first 2 weeks have nothing to do with funding. It has to do with how do we best serve our children. Something that Mr. Parmenter referred to when we had to shut down schools in such a rush in the spring, it was really jarring for teachers and students. Students had a hard time getting students ready for that. We actually even had some students, we couldn't send them home with technology, so they had to come back in. Some of our really, some of our students who are children of refugees and families who don't speak English, or children that are homeless or move around a lot, it was really hard to connect with them and get them their technology. So it is very important that we can get all the kids, provide them transportation, get them into the schoolhouse to get them set up on their technology, and also create a connection, a human connection with their teacher. We believe that the online learning will be more engaging if they've actually met each other and developed a little bit of a bond. So that is why we're doing this orientation in the beginning. But for parents that are concerned about that and they don't want to send their kids in for the orientation, you don't have to. You don't have to. There were a lot of questions about EC services and how we'll provide that either during Plan B or during, during the remote learning. We are prepared to continue. Our EC team has worked really hard on how we're going to adapt, how we're going to honor students' IEPs, honor their 504 plans, take care of students with disabilities. A difference between now and the spring, when the governor had us shut down schools for students in the spring, we were not allowed to bring kids into the schoolhouse. This time, that's different. And so there are certain disabilities that I think will be very challenging to serve remotely. And my hope, I'm speaking as one board member, and we don't have this all sorted out yet, but my hope is that for some services that cannot be provided remotely, that we can, if the parents agree, bring them into the schoolhouse to meet with their teachers to get, or their occupational therapists or what have you, to get their services met. So I wanted to speak to that. Let's see, I spoke about AP and IB classes. There was a question about performing arts. And that, I think with band and chorus and art, a lot of those things, I think our teachers are going to be very creative in adapting and meeting those needs as best we can. I understand that there are some things that are going to be really difficult to do remotely, and have to acknowledge that. There were a lot of questions about the quality of what this remote experience will look like compared to what it was like in the spring. And again, as Mr. Parmenter alluded to, that we had to kind of reinvent things on the spur of the moment when we shut down schools in the spring and went to remote learning. This time we've had all spring and summer to work on building out these remote lessons plans. We have hired, or we actually brought in 70 of our kind of star teachers to help design these lessons over the summer. Grading will occur in the spring. Based on, state mandates, we were not allowed to grade students. That was not a CMS decision. That was a statewide decision. This time students will be graded, so that motivation will be there. We will be moving forward with curriculum. I mean, the same things that you would be learning, the same subject matter that you would be learning in the schoolhouse, you will be learning from your same teachers, but remotely. It will look different, but the same subject matter will be covered. I anticipate it will be rigorous. In some cases, it may be more rigorous than before. These lessons have been designed with a keen eye towards equity. And so we have had an issue in the past with some of our schools. The teachers have been, I don't know, they have just been more slack. And so these are going to be universally rigorous courses across the board. I actually think in some ways that's a silver lining to what we're going through. It's a very small silver lining. There were some questions about social emotional learning. Lesson plans are built into each day regarding social emotional learning. In fact, your child's teacher will be, I'm going to read this from a quote, your child's teacher will intentionally build relationships to make every child feel welcome and included in a remote learning environment. Students at all grade levels will engage in 40 minutes of explicit social emotional learning daily. That is built into these lesson plans.
Elise, can I a second?
Yeah.
Give you a little break?
Sure. Thank you.
Can you hear me? Sure. I just didn't know if Dr. Sullivan or Mr. Parmenter wanted to comment on social emotional learning.
Yeah, this is Dr. Sullivan. I mean, I think that I read some of the questions and know that that is a really big concern. And I think I do believe that everybody agrees about the importance of education, right? I think everyone here and everyone agrees that social emotional learning is such an important part of that. I think we know that kind of the in-person social emotional learning, the amount of dedication and work that CMS and emphasis has put on that has been truly remarkable. And I think that there are challenges on the virtual setting, but I do think if we are in a virtual setting, as Elise just said, it will be incredibly important to make sure that that is still a huge emphasis as well. But I recognize kind of as a parent, kind of that validation, understanding the interaction with other kids and just how important that is as a pediatrician. And so making sure that that's not lost, whatever manner that the school board or the school decides to do.
And if I could chime in on that one also, I think that I'm really happy to hear that we've had some of our best and brightest working on how to solve this problem over the summer, because honestly, like a lot of the social emotional support that we're able to provide our students begins with us having a strong sense of community in our schools and in our classrooms, and that's something that's really difficult to replicate on a virtual basis. But I wanted to tie that also to the question about starting with a 2-week period of in-person rotating instruction. I understand the point of view that if it's not safe, it's not safe. So why would you risk people's health for that period of time? I'm glad to hear that parents will have the option of not sending their children to school with no penalty during that time if that's what they elect to do. And it's true that, anytime that what we know about this virus, anytime we have like numbers of people congregating, there's an added element of risk, and that's all true. I have to say that as a teacher, having spent 25 years trying to figure out how to motivate students, that my ability as a teacher to get students to do the work that I'm putting in front of them, especially if it's rigorous work, depends on the quality of the relationship that I have with them. And, up until last week when the board's decision was made, I was trying to figure out how am I supposed to have an effective instructional year with students who, in many cases, unless I've seen them in the hallway at school, I probably have never had a conversation with them before. And so I think that, having at least a little bit of an opportunity to get to know them as a person to start to build a relationship that will give me kind of a foundation to build on for the school year. Also, there's going to be, even though we've got a lot of streamlining going on at the district level, every teacher has different expectations. We're going to have at least some variety in materials that are going to be used, probably complicated schedules that we'll all have to get used to. And so having an opportunity to explain those things face to face from a distance will be helpful in terms of just making sure that my students know what the expectations are for when we return to remote learning. And then, I want to be honest and say that we're going to have a lot of strict new protocols for students to follow in school for this 2 weeks. And then I would imagine that at some point in the future, if we return to Plan B, if our metrics are at a point where that's a safe option for us, then we're going to have to do this kind of schooling as well. You all know, I'm sure, as parents and as people that have worked with kids, what the honeymoon period is. And as a teacher, I can say that if we have new protocols that we're trying to follow and get students to follow in terms of how you walk down the hallway in a line on this side of the hallway, not hugging your friends, keeping your mask on, those things are much easier to do for a limited period of time at the beginning of the year. And I think that, we will be more likely to be able to get those things right during that 2 week window, and also to identify what are some problems that we need to be able to solve for further on down the road when we return to, more of a consistent in-person experience.
All right, thank you. So let's return to your questions. Remember, I want to remind everyone, we capped it at 200 questions. We were trying to get through those. We have less than an hour left. So asking us to answer additional questions in the chat may not be possible right now. We are doing the best that we can. Please understand that. Elise, do you want to take it back up?
Because I'm trying to get through as many as I can. Can you all hear me? Yeah?
Yes.
Okay, good. Okay, there was a question submitted about polls, polling parents, and I can say in June, Elon University released a poll that basically showed about 1/3 families wanted all remote, 1/3 of people polled wanted all in class, and 1/3 of the people polled wanted a blend of the two. So we kind of knew going into this, whatever we decide, we're going to make 2/3 of the people very unhappy. And that just freed me up to say, okay, I need to do what I think is best then, rather than try to make the most people happy. That's my job right now, is to just try to strike the best possible balance to protect the safety of our staff and our students, while also maintaining our education process the best we can. I'd like to talk about there were a lot of questions on the medical safety side of things. So I'm going to read something that I got from staff right before this opened, because I want to be very clear and accurate about how we're doing screening and quarantining and contact tracing when we do have students and staff in the schoolhouse. And then perhaps the other panelists can chime in on this as well. But we know that regular monitoring for symptoms can help reduce the risk of exposure to COVID-19. So we are going to ask that anyone who is not feeling well or has a temperature of 100.4 degrees or higher stay home, whether that's staff or students. Everyone entering our school buildings is going to have to take a daily symptom screening checklist and an on-site temperature check. Anyone who answers yes to any of the screening questions, and I will read those, or has a temperature will have to go home. If it's a kid, they're going to have their parent pick them up, and they will wait in a special sort of quarantine room until then. It will be different from the regular sick room for kids that have other bugs. If students, so I just spoke about that. No one with a positive test would be allowed into the building. And if we identify someone who tests positive after being in the building, we will work closely with the Mecklenburg County Health Department to determine when they were at risk for transmitting the virus and whether they were in the building during that time, and if we're aware of where their infection came from. So that contact tracing is going to be very, very important. I also think testing time is going to be very important. So I'm concerned right now that it takes about a week to get test results back. I would like to see that be a lot faster. If they were in the building while infected, we will work with the health department to identify who was exposed and communicate directly with them, and determine if anyone needs to be quarantined and monitor for symptoms. Anybody else? We'll do deep cleaning and disinfection based on where the student or staff member was in a building or on a bus. If we'll work with the medical experts at the health department to determine if a building needs to be closed, a school building needs to be closed. And it is also very important to remember that if someone with COVID-19 is in the building or anywhere, and you are wearing a face mask and maintaining 6 feet of distance from others and washing hands regularly, that can prevent the infection from being spread. That's part of why it's so important to do those things. So these are the symptom screenings that people will be asked. In the last 14 days, have you had close contact within 6 feet or at least 15 minutes with someone diagnosed with COVID-19? Or have you been told by the health department to quarantine? That's one question. The next question, since you were last at school, have you had any symptoms such as fever, chills, shortness of breath, difficulty breathing, new cough, or a new loss of taste or smell? The third question is, since the last time you were at school, have you been diagnosed with COVID-19? So those, I think it's important to kind of go through that. There was a question about PPE supplies, but let me just see if any other panelists want to chime in just yet.
Yeah, so this is Dr. Sullivan. I can just, oh, sorry, there was some echo. I can just add to that a little bit. And I think, one of the important things to recognize is, as we talked about, there are measures that, can be put in place to kind of reduce risk, right? We know this is spread through close personal contact. We know there's a lot of contact at schools. And so the really question is, how do we put those measures in place? Those screening questions that you just talked about are incredibly important. And one of the things, we often hear the words contact tracing, but really in an ideal world, contact tracing is incredibly easy because you're not having close personal contact and you're preventing that through a lot of the measures that were already there. This is something that we have done on a very regular basis over the summer with our child cares, with our camps. This is very now routine to us. And I think we have seen incredibly successful measures being put in place in both the child care and the camp setting that has allowed us to see how these screening questions and everything does go in place. And I think we look forward to continuing to partner to kind of move that forward.
Magnets. Oh, am I back on? Okay, you can hear me, right? Okay. So if you sign up for the full remote academy and you're in a magnet, you do not lose your magnet seat. There were a lot of folks from Language Immersion Magnets who submitted questions asking how can we do language immersion remotely. That will be a challenge. Principals are working on that right now. But whether we're in Plan B plus remote or whether you sign up for the full remote academy, we will do our best to, make that the language immersion experience, recognizing it is a global pandemic and we will just do our best. But the key is that you will still be enrolled in your magnet. You will not lose that seat. let's see. There were questions about PPE supplies for staff. I think there were some teachers who had submitted questions about this. There were a number of questions. And I wish that we had a lot more. I wish that, I will just list you what we have to start off with. For all staff, we're going to have 5 face coverings provided by the state, an additional 2 face coverings provided by CMS, individual bottles of hand sanitizer. For nurses and designated staff who are handling screenings and medical issues, there will be gowns, face shields, gloves, and surgical masks. These have been supplied by the state for the first 2 months. And then certain groups of staff, such as bus drivers, cafeteria workers, custodians, special education teachers, will have additional PPE furnished according to need, meaning gloves, face shields, goggles, things like that. There are, perhaps the legislators could chime in on, hearing some noise there. Especially with so many districts across the state going to remote, I think we're going to need funds for a lot more PPE and safety equipment when we come back. We absolutely need our students and staff to be safe, and that is part of the challenge. So, that is going to be kind of one of our requests for the General Assembly. We're also, I don't know if you guys want me to, I just thank you, Representative Lofton, for your budget flexibility bill. That will be incredibly important. There were some questions on, if we're closed, why can't you just use the savings on, you're not using the buses, why can't you transfer those savings into other new expenses that you have? Right now, we're not allowed to do that, but with some additional flexibility from the General Assembly, I think we'll be able to be more nimble in how we serve students during the pandemic. I know you guys have a lot more questions about what class is going to look like. And if you like, I think the best way to answer that is going to be at the Facebook Town Hall on Thursday, where you'll have actual academic people who designed these lessons to walk you through it. But I do have a little bit here that I can share with you. For grades K through 5, you will have real-time learning with the teacher. We call that synchronous learning. Real-time learning with the teacher, with the whole class for about 80 minutes. And that in that time, you will have social emotional learning, you will have reading with the whole group, and then you will have math with the whole group, and there will be little brain breaks throughout. So you won't have you don't have to have kindergartners sitting there for 80 minutes straight. There will be brain breaks. And then there will also be small group breakouts with the teacher for 40 minutes. So that's reading phonics, doing some math small group, and those will be interspersed throughout the day. In addition, so that's 120 minutes of the day, and this is K through 5 again. In addition, there will be some independent reading and learning time. How much time that takes depends on the pace of the student. So that's where kids will be practicing reading, math, science, and social studies. That could be up to 225 minutes. And then you will have your special classes special area classes for 45 minutes in a day. So that might be art or music. So that's K through 5. Let me see if they've got 6 through 8. Okay, if you'd like to hear that for 6 through 8. I'm seeing a lot of questions about metrics on the chat, and we did discuss that in the beginning. We're developing those metrics. We have an internal team at CMS that is working with our health partners at the county and the hospital systems to develop those metrics. Okay, grades 6 through 8. You will have 45 minutes of social emotional learning in a day. You'll have about 60 minutes for English language arts. Real time with the teacher will be half of that, 30 minutes, and then independent time will be 30 minutes. Math, you'll be looking at about 60 minutes daily on math. Real time is 30 minutes and independent time is 30 minutes. Science and social studies will be 55 minutes daily or 75 minutes every other day. This includes real-time instruction with teachers and independent learning. And then with the electives, also same time frame, 55 minutes daily or 75 minutes every other day. And this includes real-time instruction with teachers and independent learning, and then 30 minutes for healthy active child. Then high school. Each day will be 45 minutes dedicated to social emotional learning. The courses, let's see here. I'm just going to read this right from the page. Minimum of 75 minutes. Strongly recommended that there should be a minimum of 40 minutes of instruction, synchronous or a video per class per day. And that's whether you're on a semester, long class or you have an A-day, B-day schedule. Your real-time teacher interaction should take place at least multiple times per week. And then there will be independent self-paced learning. Let's say here, independent self-paced learning minutes are guided by student learning needs, but are not to exceed reasonable developmental time frames. Recommended times are 30 minutes per class per day. And with high school, you will have, there will be a variety of ways you can take courses. It may be teachers that are already, at your class, at your school. You might be assigned to a course with a teacher, or you could choose to take one of the Edgenuity online courses or one of the NC VPS online courses. Does anybody else want to take any questions?
Yeah, I can.
This is Representative Hunt. I would just like to say one question that was asked and sent in earlier, asked about ADM and whether, because children will not be at the regular number on the 20th day of school, which is usually when funding is determined, how we will determine that. And the legislature is looking at using the ADMs from last year and freezing those for this year. So that is the answer to that question that was asked.
And just to, hey, this is Representative Harris again, about Chairwoman Dashu mentioned kind of help from the legislature for, especially with PPE and other funding. As I mentioned earlier, so the legislature is out of session now, and we're not scheduled to go back until the first week of September, just for a couple of days. And it's under everyone's likelihood that we expect that session will be to allocate some more money. We still have a decent amount of CARES funding from Congress to allocate, and I would assume most of that will be related towards, again, school instruction and making sure that our schools have all the PPE. We're just kind of working through these next few weeks of as every school is kind of making their final plan of seeing that, okay, where are we actually going to be? What are we doing? What do the schools need? And then we can go and make sure that we allocate those resources as they need to be.
And this is Representative Lofton. I'll just reiterate the point made by Chairwoman Dashu, and also that relates to what Representative Harris just said, which is obviously our district is trying to respond to a changing pandemic, a changing situation. I think Justin Parmenter mentioned this earlier. We just had data published about the transmission of COVID-19 of kids over 9 years old versus below 9 years old. And that's because we're learning about this as we're experiencing it. So I think it's going to be critical as our school district tries to respond to conditions as they change on the ground, figure out what the metrics are and when we can actually safely go back into the classrooms, I think we're going to need to give our districts as much flexibility as possible. And again, that's where that budget flexibility comes in, so that if there is money that's being saved because it's not being spent on transportation or driver's ed or other things, that it can be used for remote learning expenses or PPE or other needs that the district has.
This is not ideal at all. I mean, I'm a mother too. I have a rising senior. I'm, thinking about what his senior year is looking like is pretty heartbreaking. I am really, really concerned for some of our children who, their parents may not be on this call, but a lot of our kids that live in the Crescent or communities of color are getting hit the hardest by the pandemic. And they're also going to struggle the most with the remote learning. So whether we bring them to school and increase the healthcare risk, we can't afford to do that. But having them stay home and do remote learning is also, this is a terrible dilemma. And so we want to get our students back in the classroom, at least under Plan B, as soon as it's safe, But safety has to come first. And that means safety for our students as well as for our teachers. And the science is complex and evolving. And so I feel like with all of the feedback that I've gotten, everybody seems to interpret the science differently. And so I've had probably half the feedback I've gotten is shame on you for basing your decision on politics and ignoring the science. And then the other half have said, good for you for standing up for the science, making your decision on science and ignoring the politics. And so all that I can say is we are doing our very best to navigate our way through this, balancing these needs where there's no good solution. But Lord knows I ran for school board because I care about education for every one of our children. And so to be in this situation where our kids are learning remotely is certainly was not in the master plan.
Elise, our doctors speak to the health risk as well. I think it's so confusing. People have different ideas. Meg, could you speak to that?
Yeah, and I will admit, I think one of the most challenging things about this pandemic has been that this is a new virus and the information seems to constantly change, and that every time we think we learn something, different information comes out. And I think probably most importantly is that when data comes out, the data can be interpreted in many different ways. And so I think it becomes really challenging. I think what is kind of universally accepted is that, fortunately, children have not been as impacted from kind of severe outcomes of this virus as have adults, and particularly older adults, those over the age of 65 and individuals with chronic medical conditions have been much more severely impacted than younger individuals without chronic medical conditions, and then even to the most extent children. And I think that that's something that we can all be thankful for every day. The second thing is, though, we do know that we have seen some instances of severe infection in children, and we have heard specifically about a new syndrome called multisystem inflammatory syndrome in children. Fortunately, again, those numbers have been incredibly low, and the majority of children who are infected either have no symptoms or mild symptoms. So I think that at least for right now, based on what we know, is true. I think the second question, and I think there's been a lot of questions that I've seen in the chat about this too, has been about both the susceptibility of children and then the ability of children to be able to transmit the virus. And I think from a susceptibility perspective, we do recognize one of the reasons this is so hard is that nobody has immunity to it yet, or very few people now who have been infected by it, and we don't know about long-term immunity. So we know, again, that children are susceptible. It's just we fortunately have not seen significant illness in children. In terms of transmissibility, this is still where more and more science is coming out. There has been mention that there has been a lot of data that initially came out that showed that the majority of infections that were passed in households seem to be more from adult to children than from children to adults. However, as someone just mentioned, there has been a recent study that just came out that did talk about older children potentially being able to transmit as effectively as adults. Again, that is one study. And I think we still need to have more data on it. There still seems to be somewhat of a consensus that younger children do not as effectively pass the virus to others as they do for some of the other infections. As a pediatrician and a public health official, I can just hear probably some people listening are just frustrated because it sounds like we're kind of talking in gray areas, but unfortunately we don't have all of the answers on this. I think, again, we do know, if we're talking specifically about children, that their risk of severe infection is lower. It seems like for younger children, their ability to transmit the virus is lower. I think what also is important is that we have seen throughout the past 4 months, we do know ways that we can significantly reduce the risk of infection. That is through face coverings, that is through social distancing, that is through effective screening. And I think that all of those things need to be taken account as we start to work to get kids back in school. Right. I do think that we need to start from there. That is the ultimate goal. We recognize that from, again, as parents, as pediatricians, as public health professionals, as teachers. I think everyone needs to be committed to that. I think the other thing we need to realize is that, unfortunately, this virus is going to be with us for a while. And so while, yes, it kind of the immediate decisions are incredibly challenging, we also need to think about kind of the long-term solutions and how do we truly live with this. And so as we think about if the ultimate goal, whenever that is to get the kids back in school, what do we need to do as a community to do that, right? How do we improve what we are seeing in our community right now so we do reduce the risk? What do we need to do to put measures in place in school? And I know the school board and the teachers and CMS have been working really hard on that plan, and we've been collaborating on that. What do we need to do if there is a case in the school, and how do we immediately kind of identify it and reduce the risk of further transmission in the school? And then what do we look for as saying, how do we know when school is becoming a route of transmission for kids and when we close it down? I think those are all the questions that we're continuing to ask.
Great, thank you. We are going to go back to Chairwoman Dashu for a few more questions. She has a very big board meeting tonight. That has information about it has been in the chat, and she has a closed session before that, so she has just a little bit more time. She has to go before 3:30, and then I thought we would come back to talk about the mental health issue with Dr. Sullivan.
You're on mute.
Oh, am I unmuted now? Okay, thank you. I'm really not used to WebEx platform. There were some questions about food. While the kids are in the classroom, they will sort of eat box lunches at their desks. The desks will be socially distanced 6 feet apart. Obviously, they'll have to take off their masks when, I'm sorry, I'm seeing chats here. I'm trying to get through all the questions that were submitted. So sorry if these questions are frustrating to some people. But yeah, kids will have to take off their masks while they're eating. As far as there are a lot of kids in our community who can only eat when school is in session, and that's their source of food. And so we will have grab and go lunches and breakfasts for them, just as we did throughout the spring and the summer when doing remote learning. Let's see, I know that I feel like I've gotten through most of these. Panelists, can you point out any glaring omissions? would love for the panelists to speak about mental health. And Mr. Parmenter, I don't know if you have anything to weigh in on what mental health might be looking like in the classroom as well in Plan B. an example of a daily schedule. I think I walked through that earlier. So yeah, I mean, I could roll through that again if you need, but you want me to roll through that again? Or do you want me to?
I think we'll be able to maybe Justin, would you be able to give kind of an idea of how you're viewing what your normal virtual day would be as you go into Plan B?
Do you mean as we go into the first 2 weeks of school that are planned as that 2-week period of Plan B?
Yeah, I think that would be good for the parents to understand exactly what's going to be happening.
Okay. Well, I've got some bare bones detail. Chairwoman Dashu may have more information about it, but I know that we're starting out the first 3 days with. So, for example, my students would be divided into thirds. First 3 days, I would see one group. During that time, the other 2/3 of my students would be at home, engaged in remote learning lessons that are a part of my curriculum. And then we've got 4 days where the next group rotates in, and then the final group would rotate in after that. And that would take us up through August 31st, I believe. Yeah, I don't know if there's any other detail on that, Ms. Dashu.
No, that's good. I just saw a question too about will teachers be in the building? I think there will be once we're doing remote learning, I think some teachers will be in the building. They will be encouraged to be in the building, but some teachers are going to need to be working from home as well because if they've got their own childcare issues. And I do need to go pretty soon to get ready for closed session and then a real long board meeting tonight. So I thank you all for the opportunity to share what we know so far. I know this is a lot to absorb, and a lot more information can be shared, or maybe shared in a slower pace so that you can actually take it all in. I'm grateful to the representatives for having this opportunity, but this is kind of a tough way to answer all of these questions. They're kind of coming at us from every different direction. So glad to have any opportunity to get some information out. I know that people have a lot more specific questions, and I will relay that to our staff and let them know there's an interest in knowing really what a day in the life is going to look like. I hear that, and so I will pass that along, and we'll get the experts to answer that for you, most likely on Thursday at the Facebook Q&A. Please do tune in tonight, and I know that this is a big challenge for our families. Some of us more than others, but a big challenge for our families to adapt to. None of us chose to be in this pandemic. We all have some different ideas as to how best to get through it, but we just have to get through it. So thank you for supporting one another and supporting your kids and supporting your teachers while we get through this historic crisis. And with that, I'm going to sign off and get ready for my meeting and probably see you all online in a couple of hours. Bye.
Thank you so much, Chairwoman Dashu. This is Representative Hunt. We did not mean to send you 200 questions to answer and also to expect things to appear in the chat room. So we very much appreciate you are doing a Herculean task. I cannot imagine being in your position, and just know that we wish you all best wishes, and please let us know how we can help you.
Thank you so much. We will. Take care. Bye-bye.
Okay, bye-bye. All right, so now I thought we would let Mr. Parmenter, if you wanted to speak a little more about the day in the life or anything else you wanted to end up on, and Dr. Sullivan, if you could speak on some mental health issues, and then we're going to wrap up.
Yeah, actually, I thought if it's okay with you, touch on something that we really haven't heard anything about, haven't heard any questions from the parents about, and that is, kind of like the whole teacher concerns, how teachers how CMS employees are viewing this experience of working and educating kids during a pandemic of this seriousness. We have 19,000 employees in Charlotte-Mecklenburg Schools. And, among them, we have a lot of people who fit high-risk categories for a lot of different reasons. And we've got, as far as I know, we've got a limited number of remote teaching opportunities, which means that, when we get back to Plan B, we're going to have employees who are forced, just like many parents are right now, to make hard decisions between supporting their families or putting themselves at risk. We've got we administered some local education advocates administered a survey the last few days informally, but we got about 3,500 responses, I think. And from our colleagues, we've got about just about 80% that say that they have deep reservations about returning to an in-person teaching and learning situation. And I've seen some talk in the chat, and it's a perspective that's out there. This is just like the flu. Why are we making such a big deal out of this? As an educator that's been working in public schools for this, we heard the idea of chronic underfunding a little bit earlier. We're really used to having to work with not enough resources and just figure out a way to make it work. And that's fine. That's come with the territory. It's just something that we embrace as a part of the difficulty of working in education. The stakes are a lot higher than that now. So it's not just a matter of, I can probably handle having 40 kids in my classroom and dealing with the behaviors that comes along with that. The stakes are a lot higher than that now. And they're really, apart from that infusion of federal money that we saw last spring, which probably isn't going to go nearly far enough, there hasn't been any reason for us that are working in the schools to think that dynamic is changing and that all of a sudden we're going to have all the resources that we need to be able to keep ourselves safe, keep our kids safe, and support everybody in the ways that they need it. So you talk about mental health support. So if those supports are being provided by primarily by school counselors whose caseloads are so huge that they're forced to spend the majority of their time doing paperwork, they don't have we don't have the staff to be able to provide the supports that our students need. And that's not a new problem. That problem has been in place for a long time, but this crisis is really exacerbating that problem. So I hope people don't see the idea that we need more resources as educators trying to dodge your criticism in some way. It's just a fact that we don't have what we need, and before that might have been okay, but now the stakes are far higher, and they involve the health and safety of your children and of me and my children and our families. So it's something that we really need to take seriously.
Thank you. And Dr. Sullivan, can you speak a little to the mental health issues that are occurring now?
Yeah, and I think I would just want to say too, just to go back to what I was talking about before with what some of the science and data has been saying, one of the things that has been incredibly challenging is to get the perfect public health messaging out about this virus. And I don't think that I know I personally haven't fully succeeded in this idea that what we have seen, and again, what we talked about, fortunately, children have not been severely impacted to the large extent. And the majority of people who do get this virus, have mild to moderate symptoms. And I think that to kind of have that level of reassurance is incredibly important while still recognizing the impact that it has had, particularly in our higher risk populations that we talked about, and really asking people to take it very seriously. So even people who are not at high risk, right, still need to be taking all of those measures that we're asking everyone to take so that we can avoid transmission in our community. Even if you're somebody who may have asymptomatic or very mild symptoms, we still all have that responsibility. And so how do we find that exact message that allows us to mitigate the spread in the community so that we can go back to kind of more normal lives? And I think that is really hard. I think also what I didn't talk about before, so again, so to provide that reassuring, but not to say though we still do need to take it seriously, but recognize that for many people, it is a kind of a mild to moderate illness. I think we also want the data that I didn't talk about is to recognize that we do have other adult staff in the building, and we also have children that do have chronic medical conditions. And so I think that as we work to get kids back in school, there absolutely needs to be an option, right, for children who are at higher risk and for teachers who are at higher risk to be able to continue remotely. And so I want to make sure when we talk about the data that we don't ignore the teachers, but we also, again, try and get that perfect message to recognize this. I think the question that we see a lot about is about the flu. We know that there are viruses out there. We know that COVID is going to be with us for a while. One of the things that's probably more challenging about COVID is A, the susceptibility, B, the fact that at least right now we don't have a vaccine, and C, that it seems to be, at least based on what we know, more highly contagious than any other virus. And so I think that that's one of the differences, and that's why we've seen this rapid spread. That does not mean that, again, we can't figure out how to live with it and get kids back in school. We just have to be able to do it in a way that is different than some of these other viruses. And I think that that's what's really important. So as we work towards this, I mean, all of these mixed messages that are coming out to say that it's incredibly serious, but yet you'll be okay, but yet it's serious and take it serious, that really takes a toll on the mental health, right? And I think that takes a toll on the mental health of teachers, on parents, and on students. And I think that that's important to think about as this decision is made. I also think then this decision, at least right now, to start off remotely will have kind of, again, mental health impacts. Children really like being with other kids, right? And so I think as parents and as teachers and as CMS individuals, we have to think about how do we facilitate those interactions in a different way and really take into account the toll that might have. We also have to recognize that for working parents who are trying to both telework and educate their kids, the toll that this may have, and how do we make sure we put enough measures in place to support those parents and set up the structure so that it takes that into account. And then I think the same thing with teachers. And as we, again, work to get kids back in school, to recognize that there will be a toll there too, because school won't look like what it used to look like. And how do we kind of really take that into account as well? So I think that is also really important.
Great, thank you so much. We were going to, everyone gets a closing statement. I'm going to go last. So if we want to start with Mr. Parmenter.
Yeah, I just wanted to thank you all again for, for honoring the teacher perspective and just, including me in the panel. And just to reiterate that, I think last spring we were flying, building the plane as we were flying it. And I understand a lot of the frustrations that we're hearing from parents. I think we're in a better place right now to be able to provide a more high quality, rigorous educational experience for our kids. And would just ask the community's understanding as we make hard decisions that are designed to keep your children safe and to keep all of us safe.
Thank you. Dr. Sullivan?
Yeah, just as we struggle with kind of the public health messaging around this, I think that this is a topic that's really hard to think about the perfect thing to say, other than to understand, again, as a public health professional, a parent, a pediatrician, and a former teacher, education absolutely has to be prioritized. And as I had talked about before, as a community, we need to really continue to focus on what we need to do, what hard decisions we need to make about what we're prioritizing, what activities we're prioritizing in our community, what prevention measures we are all taking and encouraging our neighbors and our colleagues and everybody else to be taking, so that we get to a place that we can start talking about, getting things more back to normal, but also recognizing just how important it'll be to put prevention measures in place in the schools. I think as the health department, our role is really to try and provide as much accurate information as possible, as much data as possible, and really help us work to do the best that we can do to kind of support our kids, to support our teachers, and ideally get kids back in school.
Right, Representative Harris.
Thank you, and thank you everyone for joining us today. Thank you, Dr. Sullivan. Thank you, Justin. Huge thank you for Elise Dashu. As I said in the beginning, school board is probably the toughest public service you can have, because it really is hard to juggle all these things. And going back to kind of what we're trying to accomplish here is similar to with the economy reopening, is like we all want people to go back to work. We all want our kids to go back to school, but we have to make sure that we weigh the health risks, and the economic risk and the mental risk with everything involved here. And it's not an easy answer. And we're trying to do things as best given the advice that we have from our medical professionals, given the advice that we have from the science that we know about this virus. And it's evolving, and we're trying to make these decisions as it's evolving. And if you look at how kind of North Carolina is performing, again, our death rate isn't as high as the states around us that have reopened faster than us, that have chosen different ways to go to school. And you've seen states that have said, we're going to reopen all of our schools, facing huge backlash, not only from teachers, but then also from parents. And so this is a complicated issue. And as we're trying to approach this, again, trust me, we are listening to you. We are hearing everything that you want us to hear. We're listening. We're coming to the table. We're trying to open these lines of communication. So please keep reaching out and letting us know, because they are shaping our decisions, as is the science and the health officials, as we work to make this happen as best as possible. So thank you all for joining us. And again, the best way to get our kids back to school, the best way to reopen is use these mitigation standards. Wear your mask when you go outside. Socially distance. Don't go in large groups inside. Don't go in large groups outside. Just do what we can so that we can get over this as fast as possible, so that we can then approach our new normal as we're waiting for this vaccine to be available. It truly is in our hands, and we have to hold ourselves accountable and our communities accountable to make sure we get to that level as fast as possible. So thanks again for joining us.
Representative Lofton.
Thank you. I also, of course, want to just start by thanking you, Representative Hunt, for organizing this event. And I also want to thank Representative Harris and all of our panelists, Justin Parmenter, Elise Dashu, and Dr. Sullivan. You know, as I mentioned, I'm the parent of 2 CMS kids, and I'm, like many of you, deeply concerned about these issues. I'm struggling trying to figure out what this past semester has meant for them and what the future means for them in terms of their academic and social and emotional development and growth, and frankly, how I can even try to support them in that, as I try to work remotely, and my wife Kelly does as well. But I know, and I'm grateful for the work that CMS is doing to try to figure out how we can best educate our kids, support that development in the safest way possible. And I know that their ability to do so is impacted by at least three different inputs. So we have what happens in the classroom, we have what's happening in our community, and then we have the support that they receive from our state and hopefully our federal government. And so I know that while they're working hard to try to figure out what can take place in the classroom to enable kids to be able to return safely, they're not obviously operating in a vacuum. That's going to depend, as Representative Harris just said, on all of us making sure that the conditions in the community enable kids to go back in the classroom. And so if you read some of the studies about kids in schools in other countries that have reopened their schools, and even the American Academy of Pediatrics, one of the biggest factors they point to is community spread. So it's our job to make sure that we do our part, that the community spread is lowered, that our rates of transmission are lower, that we do what we can to help create the conditions that will better enable our kids to be able to safely return to school. And then as a legislator, of course, I'm fully committed, and I know my colleagues are as well, to making sure we do our job on a legislative side to provide the funding and the flexibility that our schools are going to need to be able to successfully educate our kids safely. So I want to thank everyone for their time this evening, and I look forward to working on this going forward.
Thank you. I just want to say thank you, everyone who attended this today. This, I thought, was full of information for parents and students and all of us. And I know that you all want additional information, which you can get at the school board town hall or at the Facebook Live event, the school board. And I just want to say, please keep the faith. You can hear me. And everyone stay safe out there.
I think Rachel's having some technical issues as her internet is pushed out, but thank you again, everyone for joining. And yeah, again, if you need me, Representative Lofton, Representative Hunt, reach out to our legislative emails. We're happy to help. It's our first name last name at ncledge.net. So thank you again for joining us, and look forward to continuing this conversation. We work to get our kids back into school and learning. So thank you all for joining us.
Thank you all. This is Rachel. Thank you very much. Take care. Stay safe.
Thank you.